Thanks for joining the podcast today. I have Meghna on call with me today. Meghna is founder of Health Q Rehab, which is about a 5-year-old health tech startup. Meghna has background in physiotherapy in neuroscience, and as the founder at Health Q Rehab, Meghna has been providing services in terms of conditional and specific rehabilitation to a lot of working professionals. So thanks, Meghna, for joining me on this podcast today. And I would like you to tell us a little bit more about yourself and Health Q Rehab also.
Thank you, Priyanka. Thank you so much for having me. It's a pleasure, and it's always fun to have discussion and more awareness creation opportunities about musculoskeletal health because I think that's need of an hour. A lot of people are suffering from it, and you would be surprised to see the data by WHO, which says that 490 million people in India at this moment experience back pain. So the problem is huge, and the people who can solve it are very less in number. And the best way to solve this is only by collaboration and awareness. So glad that we are talking on this topic.
So, can you tell me a little bit more about Health Q Rehab? How did you start this, and what kind of services you guys provide?
Sure. So I'll just give a quick background about me so then everything connects. So I'm a neuro rehab physiotherapist, and I started my career in Bangalore in 2012. When I moved here, my husband is also an IT professional. He was into IT space, and so does my father-in-law. So the problem I started observing among people was within the family itself, where
Hmm.
this was very common, like neck pain, back pain was very common among the family members. And that's where people started reaching out to me. Always used to get calls from my relatives, my friends. Okay, I'm getting this back pain today. I'm feeling achy shoulder. What shall I do about it? And always I used to think, oh my God, this is such a big problem. Everybody's having it. So let's do something. Let's create something in common so that everybody can watch and learn about it. And that's how I started slowly writing blogs and trying to create small content. So first it was on a small Facebook group, which was very confined to friends and family members. And as I was progressing in my career, I also started developing my interest in YouTube on content creation side. And then after a couple of trial and errors in video creation, I started enjoying that process, and I finally decided, okay, let's start a YouTube channel officially. And that's how in 2017 I started my YouTube channel. So I named the channel as Health Q, with the key idea that this channel will be all about health quotient. It will raise awareness about musculoskeletal and any movement related health. And that's how the journey began. Being a neuro rehab physiotherapist, my attention was always towards helping people understand the neurological aspect of every problem that comes into the picture. So even a musculoskeletal pain, a back pain has a neurological aspect to it. So that was my key idea behind it. And I also used to create a lot of content on other neurological disorders like facial paralysis, then stroke, Parkinson's disease, etc. Now what happened is during COVID, the people were stuck at home and they were not having this help, so they were watching more videos, and then they started reaching out for help. And that was the beginning of this entire concept of digital physiotherapy, where I started consulting people online. And the moment the lockdown was over, people started coming physically to see me and take consultations. But I always used to push them that, see, the problem of yours is not going to be solved in 1 or 2 days. This is going to take a long period of time. And that's where you need to work in a digital way, where you come for a couple of days to the center where I operate, and rest of the sessions or the exercises that I'm giving you, you can do at your home, and it can be very well supervised online. So that's how the entire process of my practice turned into a business, which is Health Q Rehab right now. And happy to say that we have helped around 2000 patients till now from various segments of pain. And these patients are not only from Bangalore, but are from different parts of India and world as well.
That's awesome. And I think that, as you rightly put, that our lifestyle has become sedentary, and I think that inherently, I am maybe sounding a little rude here, but I think people have become lazy. Like that has been an inherent nature, and that is what is actually rising to all these chronic pain. So I also coach a lot of IT professionals and people who have this hectic work schedule, desk job, right? What are the most common issues you have seen and you have come across that is happening nowadays? Back pain is one. What are other things that you are experiencing now?
Right. So I will break this down in three categories. So the number one category is from a gender bias way. So like women. Women are more prone to develop pelvic or as SI joint pain, which is your even in low back area. To be very specific, they will have pain more around the hip region. So that's more common among women. Women are more likely to observe pain around the knee joint and the heel, since the body is designed in such a way that the weight is falling on the lower body more, their likelihood to develop that pain is more compared to men. Men are more likely to develop pain around the neck and shoulder region. This is one observation or insight that I have seen. Second observation was on the basis of age group, where people between the age group of 25 to 35, they have more acute pain compared to chronic pain. So they will have an episode of pain, it will last for a couple of days and then it will go away. Secondly, if you look at the areas which get affected, so spine being a most commonest one, but the small joints like elbow, wrist, heel, this is more common among the younger professionals. The reason being the use of mouse, the use of cell phones, or wearing heels, or not wearing the right kind of footwear. These are the common reasons why they develop this. So that's the second insight. The third insight, or as I would say also in the age group, which is beyond 30 and all, there the degenerative changes starts happening. So they observe more conditions or more pain that's related to the degeneration that the joint is going through. So that's where the joints like your shoulder comes into the picture. So shoulder degeneration is a very common problem after 30s. Even osteoporosis, where your bone starts getting brittle, that is a common problem that starts happening. So that's the second category that I would say. Fourth category is based on the lifestyle. Or else you can say based on the profession. So let's say if someone who works on desk for a very long period of time is likely to develop obviously the spine related concerns, but there are a lot of teachers who also comes to us, and they have to spend a lot of time in correcting their papers and all. So they usually develop pain around their wrist, around their thumb, around their elbow and shoulder. So again, based on what kind of profession the individual is in, the kind of condition that will come will be dependent on.
Thanks, Meghna. You have structured this really well. One thing that when I'm talking to clients who are joining my program, because I look into the holistic health, right? And if somebody comes with a chronic pain or even this kind of episodes that you're talking about, and then they want to lose weight or they want to, get better in terms of looking lean and strong, my fundamental issue becomes that if you have some pain like this, sooner or later, it will affect your lifestyle, right? You may stop being as active or your sleep quality goes for a toss, right? So I would like all of these people to kind of start investing a little effort into fixing these fundamental issues before looking into the other areas. Like they have to look into other areas as well, but these issues are equally important, which we keep on ignoring. And the way majority of us are fixing this is by popping pills. And I'm not kidding. And these are, so I am really not sure, because I've been talking to so many people, and you will not believe that literally I tell them that please do not join my program till you fix this issue. So I refuse to take their money. I refuse to take them as my clients. Because it just makes me feel really bad that they are going to doctors and they are giving them certain medication, which for some time is actually helping them relieve that pain, but this is not a solution in long term. So I want to know from you that if somebody has this kind of a chronic pain or even the kind of episodes that you're talking about, what should they do? How should they look into fixing it?
Right. See, here, no, I would like to highlight a concept called as neuroplasticity. So neuroplasticity is a concept where every pain episode leaves a negative mark within your body. And anytime the next pain episode will come, the intensity of that pain being felt will be little higher. Okay. And that's the reason usually doctors prescribe medicine. The sooner you get rid of the pain, your neuroplastic changes will also be reduced to an extent. So, ideally, if someone who is having a very acute pain, people who have chronic pain definitely have a lot of episodes of acute pain previously. Okay. So, and they ignore this pain. This is the major reason why it turns into the chronic. So the first thing they should do is don't ignore your acute pain. If you're repeatedly getting your acute pain is where it is so bad. Like we get patients who are in so bad shape that they are not even able to move even a slight inch out of the bed on that episode. Okay. In that cases, medicines are important, but because that will help you out immediately and it will not lead to a neuroplastic fade. The problem with this, the moment the pain is gone, people forget about that pain. That is the issue. They feel that the pain is gone, it's not going to come back again. But the reality is, if an individual experiences one episode of acute low back pain in 1 year, there are 45% chance that that person will get a second episode as well. But that can be fixed if you can start taking your measures on 3 areas. Number one, make sure that your muscles have good level of muscle relaxation. Muscle spasm is the cause for your acute pain, or else an inflammation is a cause for your acute pain. If your muscles are taut and spasmodic or tight, they are going to turn into painful structures, right? So make sure that your muscles are not tense. There are a lot of ways to address that by simple breathing exercises, changing your position again and again, even taking some simple stretches in between your work breaks. Those are the ways you just make sure that your muscles are relaxed. Second is your posture, the way you sit, the way you stand, the way you walk during your working hours. That puts in constant strain on certain group of muscles and relaxes certain group of muscles, right? So that needs to be addressed. And third comes your progressive exercise program. So if someone experiences a pain, acute pain episode, and is someone willing to go back to their routine lifestyle, they should start with a very simple, gentle range of motion activities. Gradually from there, they should move on to the stretching exercises, and then they should move on to the strengthening exercises. What they do, they get an acute pain, they will take a break for few days, they will pop pills, and the moment they are fine, they will be happy, they will forget about it. Or else they will immediately go to gyms and they will start lifting very heavy weights, which is not ideal for them at that stage in time. They should understand that the body requires that level of preparation to go back to the stage where they are in the position to lift that weights. So there are certain measures which are preventive enough that can help an individual to prevent chronic pain way early on, before it even starts developing, if they take these three fundamentals in place.
Awesome. Yeah, I totally agree with you here. When you have an acute pain, there is no other way than to take some painkillers to subside it, and gradually you can get into your regime. But I think many of us are on a daily basis experiencing not the acute pain, but there is like a mild pain towards the end of the day. It's like the back is really stiff, or knee pain. When people, what they do is that when all of these pains happen, right, they just stop doing things that in their mind may cause these issues, right? So somebody says that I've stopped running, I've stopped, even walking too much or climbing stairs. It has actually happened to me also long ago. I somehow found, like after a lot of years, I really found the right guidance to fix it. But still, there is not much awareness in the sense that these things can be taken care of by just doing basic stretches and the strengthening exercises that you're talking about. So, I actually fundamental question is like people think that it takes a lot of effort. Can you tell me like what is an average amount of time that you think somebody should be exercising / stretching in a week that should be sufficient to just lead a normal life?
Right. You would be surprised to hear that it doesn't take more than 15 minutes. And sometimes even less than that. Okay. Yeah. It doesn't take much of effort. It doesn't take much of time. It don't require, individual don't require any equipment to do that. If you are sitting on your desk, you can easily do your exercises while sitting on a desk. There are a lot of resources that are easily available these days where the desk exercises can be done. I think there's a lot of effort that companies have also started putting in now to raise awareness and helping these individuals to do these exercises. The problem lies in taking that initiative. Right. But a simple set of 15 minutes where you just make sure that you focus on the most important muscles which are likely to get tight, like your back thigh muscle, which are called as your hamstring muscles, your quadricep muscles. When it comes to your back, the latissimus dorsi muscle. So these are the simple muscles which are more likely to develop tightness and spasm. If you can stretch them on a regular basis, then you can pretty much prevent your pain episodes.
So let's talk about actually back pain, which I think is the most common. Correct me if I'm wrong there. Including men and women, I'm seeing that back pain is like, and this is obviously combination of us sitting long hours in the wrong form. I have certain background into this, so I know about this, but I wanted to come from you that when people have experienced back pain, right? What can be the fundamental causes of it? And if, let's say, the pain is not acute enough for them to visit a doctor for medication, what are the things that they can do at a very early stage to fix it?
See, the fundamental problem with back pain is the weak core muscles. If the core muscles are weak, back pain is bound to happen. Okay. Majority of time people focus, if they have episodes of back pain in past, they will focus on strengthening their back extensor muscle, which is the muscles that are on the back of the spine. But they absolutely neglect the abdominal muscles. But people should understand this, that for a spine to stay erect, it's a strength work for both the abs and the lower back muscles both together. And that equilibrium will maintain the spine to be erect. Now, due to sedentary lifestyle, due to poor dietary habits, right, people have got weak abdominal muscles. Whenever there is this weak abdominal muscles, the gravity will constantly pull the abdominal muscles downward, even while you are sitting. Okay. Now that will create an imbalance. So what is happening? There is this weak abs, which leads to overforce or overstretching on the lower back region, which creates the imbalance, which in medical term is called as lower cross syndrome. This is where there is one group of muscle is working too much, and it has got tired now and is absolutely weak. And the other group of muscle is working too hard and is trying to giving up by becoming more and more taut, causing imbalance, which triggers back pain, because then the anatomy of your spine changes, your nerve starts getting compressed, and the individual starts experiencing pain episode. So this is what is the fundamental cause for beginning of any back pain. Then yes, there are other conditions as well, like there are degeneration, there is the slip disc, which people call it in a layman term, but nothing but a disc prolapse which happens, or else even there are some genetic disorders or autoimmune disorders as well, like there's something called as ankylosing spondylitis, so even rheumatoid arthritis in that case. But those are absolutely a different set of conditions. The causes are different, the type of pain will be different, but majority of pain that comes begins from this core problem, and that is of lower cross and upper cross syndrome.
So I want to know that, let's say, for this lifestyle kind of pain, which is not acute in nature, what are the, let's say, 3 exercises that people can do? And I think that I just want to clarify one point here, that core is not abs. So people have been doing crunches to strengthen their core muscles. So I want to know like 3 basic exercises that somebody can do to strengthen their core muscles.
Okay. See, I would again recommend, don't fall directly into core muscle strengthening if anybody has got a chronic pain or acute pain in any of the cases. Okay. That is the first thing that anyone should be cautious of. I will never recommend that. But if someone is having a repeated episodes of back pain, I will focus more on the preventive aspect of it. Okay, where the focus is more on supporting the structures of your lower back region while you are sitting and standing, but doing regular movement. So when you say exercise, right, and there is a desk worker, a simple pelvic tilt exercise where you come at the edge of your chair, you tilt your pelvis forward and backward, move side to side. Even that simple exercise will stop that stiffness that is developing in the spine region. Majority of time, pain starts from that stiffness that is developing in the spine, and then that moves forward to the muscles and all. So simple basic movement of your spine do a very good job. Second exercise to be done is pelvic bridging, where you lie down straight, bend your knees, and then you lift your pelvis up.
Yeah.
Hold the pelvis for some time and then come down. Again, what you're doing is you're moving your entire spine at that moment, and you are releasing that stiffness that is being developed in your spine and your muscle. That's the second exercise. And the third and the very beautiful exercise is your cat and camel exercise. Very underrated, very commonly prescribed exercise, but it's an underrated exercise. People don't understand how effective it is, and people tend to make a lot of mistake while doing that exercise as well. I've seen a lot of patients doing it in a wrong way. But if learned right, it can create good amount of mobility in the spine and will allow to prevent back pain. And yes, there are many more, but 3 are my favorite ones.
Yeah. So I absolutely agree with you. For years together, I used to do cat and camel while just focusing on my lower back, because that is what we have been taught, right? You have to extend and compress, extend and compress. And then somebody told me this is a core exercise. I was like, okay, I need to be retaught. So I think that is where the job of a physiotherapist is very different from your trainer. So people say, hey, my trainer is making me do certain strength training exercises, which is good, right? But then these fundamentals, I don't think anybody else can point out better to you. So I highly recommend having a sports physiotherapist specifically, or a physiotherapist who can help us guide in these lines, just to make sure that we are doing certain things the right way for the longevity perspective, and also for people who are going to gym, it is important, and people who are not going to gym also, it is important. Because all these concepts, right, this core muscle strengthening, I have not seen people who are not gymming talk about this, while they are also the ones who need to be working on it. So yeah, I think this is really good, but I always say that don't rely on YouTube like as your the go-to place where you're getting knowledge. And this is not a university, right? People are sharing knowledge, but then again, you have to go to specialists to understand the fundamental issues and work on it. Now, I want to understand more from the strength training perspective, and kind of see that this kind of pains that we are talking about, how strength training can actually help people. So I am a strong believer that strength training is required, but still a lot of people are thinking that strength training is for people who want to look muscular, or compete, right? Or look bulky. So first of all, what is your take on that to begin with?
No, I am also on to that school of thought that strength training is very important, not only from a pain prevention perspective, but from an entire holistic health perspective. Because when you are doing strength training, whenever you are lifting weights or adding any resistance to your body, you are preventing one very important condition that can cause you very big damage in your old age, and that is osteoporosis. Right? Your brittle bones can be prevented if you are doing your strength training or any of the resistance training in that form in your initials, specifically after 35, 45, this age group, and especially in women, right? Men, definitely it is important, but women needs it more. So I believe in the school of thought. Yes, I do agree to that people think that if I don't have to run a marathon, I don't need to lift weights or do any strength training. It's a long way to go, but I guess there is this change that I'm seeing in perspective of people. Even in 40s, 50s, now people are taking that initiative to take some more proactive approaches, and they are open to learn and open to listen. All it requires is a well-articulated resources like you or me, and that's why the social media is meant for. The YouTube idea is not to be that place where you go and do the exercise, but YouTube inspires people to be more active. So that is the agenda, and people like you and me, if come together and try to raise this awareness, they will also understand that yes, this is important, and then they will start taking a proactive approach.
So one question here, and this is especially for women health. So I think still, like when I started gymming, I probably was one of the only girl there, like maybe a few would come around. Now I think there's still more women in the gym, but still we are a long way to go. So one is that women are slowly getting there, but still far away. What do you think is the most important factor for women that they need to start doing strength training?
Right. See, as I said, prevention is the key for women to start strength training. They have to do it because otherwise they will develop this condition called as osteoporosis, or osteopenia will happen to them because of the hormonal imbalance that they are going to go through. So it is very much important that the sooner they start, the better it is. Majority of time, women don't opt for gym is either the environment of the gym is not that supportive, or they feel insecure many times, or else it's not the priority for them.
Yeah.
So in that case also, it is easy to have, now there are so many programs where you can stay in touch with your instructor and you can do home based strength training. Eventually, what is the goal? Strength training is the goal. It is not necessary that you have to go to the gym to do that. Doing
Yeah.
strength training is important. Even they can use simple household items that are present in their kitchens, those boxes, they can hold that and do it. It's all about that will, and that will comes from more inspiration coming towards them.
And one thing that the degeneration, the osteoporosis that you're talking about, I actually have seen my mother got a knee pain maybe like 20 years ago or something, and she was told that she's gotten arthritis from that stage itself. And
Yeah.
believing that, she's been doing a lot of things like around doing yoga and stretching and all of that, but the condition worsened.
Yeah.
And recently she got into such a condition that her knee started locking randomly, and it was
Yeah.
painful episode, that really painful. When I took her to a physiotherapist, she was very reluctant that, okay, I don't think a physiotherapist can fix it. We probably will have to do a surgery and all of that. She was put on very basic home-based exercises. Couple of weeks down, the locking of the knee, these episodes that were happening, say 5 to 6 times in a week, they just completely vanished. And since that time, it's been 3 months. I have forcefully sent her like to gym, and she's been working out. I'm not saying that the she'll just this whole thing will get reversed in a matter of months. No, but what I'm saying is that she feels so much better now. She's able to walk much better. Like she was limping before, now she's walking better. She's feeling more strong. It's a long journey for her. So when I look at her, I'm really inspired. I think one of the goals for my life was I wanted to send my parents to gym, and this is finally happening. So do you think that the people who probably people are a little reluctant that, okay, I'm 30, I'm 40-year old, I haven't done this before, is this the right time to start? My opinion is that you can start anytime, whenever it comes to you. What do you say?
Yeah. See, I absolutely believe in it. My take is only that you keep your goal as exercising. Okay, it's not necessary that you have to go to gym for doing that.
Yeah.
Even though gym motivates you a lot,
Yeah.
and it keeps you accountable as well.
Yeah.
So in those terms, it is really good. But as I said, right, an average person who don't have very big ambition in terms of staying very fit life,
Yeah.
because we get patients who come to us who say this, that see, we want to be active, we just want that our household work I'm able to do it. The majority of women who come have that mindset, right? So what we try to say them that, see, we are not asking you to go and do anything, but be active,
Yes.
be more focused towards doing physical exercises with a goal of maintaining muscle strength.
Yeah.
Right, then there are ways you can figure it out. So gym is one of the best, because when you go there, your dopamine level is going to raise, you will feel more better, you will feel more motivated, because that environment effect is going to be there. But to reach to that environment, the internal mindset needs to be fixed first. That is where the entire thing starts. And good, see, you are this clear example of it. If you were not there, if you would not have been that push provider for your mother that you should go to the gym, and she would have never gone. Right. So not everyone is fortunate enough to get that level of push, right? There are a lot of people, so when they come to us, they are staying alone. There are a lot of elderlies who come, they stay alone at home. For them, going there, so for them, the idea is, wherever you are, whatever you can do, use that and stay fit. Try to do physical activities at that level.
Yeah, I totally agree. I think gym gives like a very formal setup for us to be consistent with it. That's the only reason.
Yeah.
But otherwise, yes, we can do workouts at home if,
Right.
let's say, we put our mind to it and be consistent with it.
Right. See, again, one more benefit of gym that is there, which cannot be ignored, is the kind of structure that it can bring to your exercise
Yes.
form, which cannot come at home. You might make a lot of mistakes, so you are more also prone to develop injuries and all. So that's where also it can impact. And this could also be a way, or else it could also be a way to correct your exercise and correct your posture as well. So when it comes to gyms or any of the subscription or anything is there, that can add up. What I see not happening there or certain gyms is they still keep your exercise regime very much focused towards the youngsters. That is also one reason why people don't want to go. So even gym, this will be a suggestion if someone who is a gym owner is seeing that if you can come up with more programs for elderly, then I guess even elderlies will be looking forward to come and do the exercise.
So yeah, I understand that gyms can help, like because it's a structured environment, you have a lot of people working out there. But at the same time, so even in gym, you see people from beginner stage to all the stages, right? And then there are some people who are learning from YouTube University, and they start coming and preaching you, even if it's just been 2 months in the gym. So I just hope that people start investing a little bit time, effort, and money into learning these movements and into learning these movements in the right way. I think for elderly people, they really don't need to do a lot of fancy and heavy duty exercises. So they should be learning from a physiotherapist who can guide them with the very basic movements. And then they can go to gym and work out. That's absolutely fine. Same goes with rest of the folks also who are going. They should have a coach who can tell them that, hey, I mean, you are lifting good in deadlift. So what I have done is like people are come and tell me I'm able to lift 50, 60 kgs, 100 kgs in deadlift. And then I tell them that, hey, just do this small correction, right? Just engage your upper back. They were like, oh, upper back also has to be engaged. Okay, fine, let me try. They can't even lift 50% of the weight that they were lifting before because the form was incorrect, right? So initially, obviously, if you are young, you will not realize what wrong you are doing. Eventually, you will. So I hope that people understand the importance of this and invest a little bit into this, learning the art itself. So, Meghna, one of the things I think we've been talking about having these kind of either chronic pain. Chronic, I would say that I think most of the people that I'm coming across have certain pains in their body, which is arising from their lifestyle. If somebody is facing those kind of issues, what should be their course of action? Like, where should they start from?
Right. So first comes to the diagnosis very clearly, because chronic pain is again a very big term. It's an umbrella term, and there are a lot of conditions, a lot of problems that comes into the picture. So the first thing that I would highly recommend is seeing a physiotherapist and getting yourself diagnosed and assessed. What physiotherapist would be able to do is to figure out where the impairment exists and would be able to set a short-term and long-term rehab goal for them. So that's step number one. Step number two is taking a lot of proactive approach in terms of prevention of pain. So even though you are having some chronic pain, there are certain ways, like as I said, changing posture for a long period from time to time, or is correcting your postural pattern, doing some physical activity that will help you to stop that will basically reduce the level of injuries that are happening or micro traumas that are happening internally. So that is second thing. Third thing is obviously progressive exercise program. People can choose what they enjoy doing, so they can choose that. But investing and working on that is critical. But one thing I would say is, if there's something called as VAS scale, which stands for your visual analog scale. Anybody can measure this. So where it's a scale between 0 to 10, where 0 stands for no pain at all and 10 stands for like a maximum pain, unbearable pain. If there is an individual who is between a scale of 4 or 5, then don't hesitate from exercise. Your pain is not bad. It's just pain which is a little bit here as well. You just start exercising. Don't limit yourself. Trick your body by doing more exercise.
Yeah, I think the norm that we have is if it is paining, you take rest and it will recover. If it is acute pain, yes, you need to take rest. But then again, I don't think a pain can be recovered and healed if you are not strengthening that part of the body. I strongly believe in this fact that if there is pain coming in some area again and again, there is a fundamental issue. Your posture is wrong. Your strength is not there for whatever task you are doing. So take this as a symptom and act upon it rather than avoiding certain actions. So, like for example, back pain comes, people stop bending forward, people stop doing anything, right? So, and this is not happening at a later stage. I think even at people at 30s, they are following that. So, yeah, I mean, take the right course of action, which is strengthening and doing the right kind of stretches. Now, I want to understand, like, one thing is that, let's say, as a beginner, if you are starting exercises, for that individual, what should they be doing when they are entering gym? So I'm sure when you go to gym, every gym is offering certain kind of workout plan. Usually it's PPL, that push pull leg, which is very common. But as a beginner, what should they be doing? Because I have not seen any these kind of plans wherein basic strengthening is included. So do you have any guidance there?
Yeah. So my key advice would be go slow. That's number one thing. Don't get overwhelmed by looking at other people who are, having big muscles and they are performing great. Understand that you are different from that person. They have taken that period of time to reach to that stage. So does you. But keep your fundamental three things in mind that's crucial for any workout. Number one is your warm up is very critical. Now, here also I see people making mistake. They feel that stretching is the only warm up. In fact, it's not true. It's not necessary that only if you are stretching then you are warming up. A simple shaking movement like shaking of your hand or shaking of your leg, you activate your lymphatic system. So before you activate your blood circulation in your muscles, you need to activate your lymphatic system, remove that extracellular fluid from the body. Then only you can start acting on the other areas. So a simple marching at the place, simple moving of hand front and back, what you're doing is you're preparing your body to move. So that should be your ideal warm up compared to just start doing stretches. In fact, if you go in the morning to the gym, you have slept whole night, okay, you will have tight calf muscles. This is given. Why? Because whole night your foot was in this position, they have not stretched it, nothing, and immediately you hit the gym and you stretch all of a sudden, okay, there's a lot of chemical that has been accumulated in that area. You're going to break, you're going to cause micro tears inside these muscles. So the better practice is, once you go to the gym, do some barefoot march pass, just move your ankles up and down, pump blood to that area, then you start your workout. That's number one. Second is stay hydrated, because when you don't stay hydrated and you do workout, which is more, you will end up in cramps, which is very common in gym people, like people who are gymming, right? So they will develop cramps at night, or all of a sudden they'll get this cramps. This happens due to dehydration in the body. So that is the second thing that they should do. Third thing is cool down. Now, again, same principle apply. You have done a very high intensity exercise. Now you are allowing your body to settle back and come back down. Okay. So at that time also you have to slowly pace it back to gentle activity, slow, so that your body is settled now, your heart rate has come under normal, and your body is now ready to move further. And the fourth thing is your cryotherapy is very effective, and I see a lot of it's getting a lot of popularity these days, and it actually helps. So cryotherapy also works on this concept of vasoconstriction and vasodilatation, which means that when you are having a worked out muscle which is having too much of blood circulation going on, when you dip that body area in the ice, right, it's going to stop blood for a very small or brief period of time. It will reduce the speed of the blood circulation that's too high, too hyper at that time, and it will allow your body to come back to the normal, right? So these way you prevent further injury, overheating of the muscles, tear of the muscles, which is very common during the gym-based activity. All of those things can be prevented if warm up, cool down, hydration, cryo. These are the things that are taken care of.
Now, my second question is for the people who start any kind of exercising and they get into running because that seems the easiest of all. And obviously, it's like simple maths, calorie deficit in and out, I will lose weight. And eventually, so maybe there is not the right warm up or the strengthening, but they start developing these pains, right? So, what should people either, if they are into running formally, like if they are preparing for long distance running, or even the people who are starting new into running, what are the things that they should be considering before getting into this?
Sure. See, running compared to gym is a opposite format, right? This is
Yeah.
more of a cardio format. So as the name suggests cardio, you have to take your first priority as your cardiovascular system.
Mm-hmm.
Now, if a person is diabetic, if a person is having cholesterol, if a person is having any of the heart health issues, then the first thing they should do is they should get their TMT tested. Otherwise, there's a huge risk of cardiac arrest when they are doing a very high risk activity like this. Okay, because your heart rate pumps up
Yeah.
very high. You are in that dopamine, you will not realize, and that extra stress can cause accident, right? So that is the first thing that they should do. Coming to the injury side of it, foot injuries and leg injuries are more common with running compared to the upper body injuries, obviously because they are using legs more.
Yeah.
The best way to fix it or prevent it is first choosing the right kind of footwear. So the footwear investment should be done very mindfully. There are a lot of people who ignore that aspect absolutely, but footwear plays a very crucial role. Good quality footwear with good amount of padding will help to prevent a lot of injuries, especially in their foot muscles. Plantar fasciitis, the most commonest runner injury, which is called as, right, where they develop this heel pain. That
Yeah.
can be prevented to a lot of extent if the footwear is right. Second, again, is the stretching of your sole muscles. Even our soles have got a sole has got muscles which are tight and are likely to be more tight in our scenario because we are running or we are walking in a concrete surface. We are not running on a barefoot on a ground where there's a lot of activation of the sensory receptors are happening. So this is a very harsh surface on which your foot is bouncing back. So to every time to maintain that friction, your muscles are going to get tight and tight and tight, which eventually leads to plantar fasciitis. To prevent that, make sure that your workout should incorporate a lot of there's something called as eye scan exercise. So it's very simple. Take a water bottle, fill it with water, keep it in freezer. It turns into ice. You just rotate your or just to and fro, do your foot over it, right? So that will give good amount of cryo increase and decrease the blood circulation on and off. So will maintain the blood flow, and then you stretch your calf muscles and the same time your sole muscles. Then you start running. Come back and do the same practice. That will prevent that injury. Second is your knee injury. That is also again very common. It's always good while running to wear a good quality kneecap when you are running. That will maintain the position of your patella bone, which is your kneecap bone, in place, because majority of time that goes in wrong place and causes injury. So that is also a good way. Squatting exercise, making sure that your quadriceps are strong enough, your hamstrings are not that tight, your calf are also flexible enough.
Yeah.
Keeping these basics in mind, you can very easily run. It is not a very difficult thing.
Awesome. I think this was great discussion. I got to know a lot of new terms for sure. So I just want some final words from you in the sense, like for the people who are just starting their fitness journey, or the people who have these kind of back pain or knee pain, uh, just like a little motivation for them that how they can really recover from it and what should they be incorporating in their regime.
So I have a very simple philosophy around this, and I say this to all my patients and everyone. Movements are simple, so keep it simple. Don't try to complicate it, right? And that's the fundamental of life. So like if 100 years back there used to be no gyms, but still people used to live a very fit life. The only reason was their work lifestyle was designed in a way which was pro body. which was aligned with their body postures and all. Now we are facing all these issues because we are living in a westernized world. So if you stick to your basics, everything is going to be fine. And keep a holistic approach to your health. Even a musculoskeletal pain can come from a mental health issues. Now I know that's altogether a different topic, but make sure that you are moving on a regular basis. Don't sit at one place for long. Move in your chair itself. If you're sitting, just move forward, go back, just go for a walk break. Do small stuff. That will prevent your injury. And take help whenever it is required. Don't assume things, don't self-diagnose, and don't self-treat yourself.
Absolutely agreed. Thank you so much for giving me your time today and having this chat with me. I hope this video reaches to everybody who is looking for help and who's feeling that strength training is only for people who want to build muscle, but this is an essential part. This should be an essential part of our lives. So thanks, Meghna, for sharing all the information with us today. And wish you good luck. And I'm going to drop the link to Health Q Rehab YouTube channel in the description below. So whoever is looking for information around these back pain, knee pain, or any of these conditions, please do check it out. So thanks, Meghna. Thank you. I'll see you around.
Talking to you. Bye-bye.
Bye.